Most men only think about their prostate when it starts causing trouble. I would rather you learn how to care for it long before that day. I am Dr. Emma Blake, a urology and men's health expert, and today I am going to walk you through the benefits of prostate massage, when it helps, when it does not, and exactly how to do it safely, both externally and internally, without pain, panic, or guesswork. If you are new to this topic, stay with me. In a few minutes, you will have a calm, step-by-step plan. You can start gently, and you will know the clear red flags that mean you should pause and talk to your clinician. Your prostate sits just below the bladder and wraps around the urethra like a soft ring. When it is calm and healthy, urine flows well, ejaculation feels complete, and erections are supported by balanced pelvic floor tone and blood flow. When the gland is irritated, congested, inflamed, or enlarged, you can see three common problems: obstructed urination, obstructed or uncomfortable ejaculation, and knock-on effects that can undermine erectile firmness and confidence. Prostate massage is not a magic cure for every man, and it is not a substitute for medical care, but for many, it can help decongest the gland, improve comfort, increase awareness and balance of the pelvic floor, and support better urinary and sexual function as part of a broader plan. A quick historical note to put this in perspective. Long before modern medications, physicians routinely used prostatic massage to relieve congestion and discomfort. Even horseback riding was once prescribed for pelvic circulation. We have more options now, but the underlying principle still holds. Tissues that handle fluid and have sponge-like architecture often benefit from gentle movement, drainage, and blood flow. Before technique, safety comes first. Do not do prostate massage if you have an active prostate or urinary infection, fever, severe rectal pain, a recent biopsy or surgery, uncontrolled bleeding risk, severe hemorrhoids or fissures, or a known or suspected prostate cancer, unless your treating clinician has cleared you. If any activity causes sharp pain, significant bleeding, fever, chills, or new urinary retention, stop and seek care. If you are ever unsure, ask. The goal is comfort, not heroics. Let's start with the two main approaches, and when each makes sense. External massage targets the perineum, the strip of tissue between the scrotum and the anus, to transmit vibration and gentle pressure up into the prostate and the surrounding pelvic floor. It is discreet, easy to learn, and often the best starting point for men who are hesitant about internal work. Internal massage accesses the front wall of the rectum toward the belly to directly mobilize the prostate and the ducts that drain into the urethra and ejaculatory pathway. Internal work can be very effective for selected men when done slowly, hygienically, and pain-free. External technique is straightforward. Wash your hands, empty your bladder, and wear soft, breathable clothing. In a comfortable position, standing with one foot on a low stool, lying on your back with knees bent, or side-lying, locate the perineum with your fingertips. Using a clean fingertip, a small massage tool, or a low to moderate vibration device, apply gentle pressure in small circles or a slow back and forth sweep for 5 to 10 minutes. Start slow and low, then gradually increase pressure to a firm but comfortable level. You can sit on a small clean firm ball on a chair to apply steady pressure, rocking slightly to change angles. Aim for 1 to 3 sessions per week. This helps mobilize fluid, calms over-tense pelvic muscles, and encourages blood flow without entering the body. If pressure reproduces sharp pain, back off. If it produces a dull, good pressure that eases as you breathe, you are in the right zone. Internal technique requires more preparation and more care, and it should still be comfortable. Clip and file nails, wash hands thoroughly, and consider a disposable nitrile glove. Choose a high-quality, body-safe device with a slim, smooth tip, or use a well-lubricated fingertip if you and your clinician are comfortable with that approach. Use plenty of water-based lubricant. If your device is silicone, avoid silicone lubricants since they can degrade the material. Empty your bladder first. Positions that make this easiest include side-lying with knees gently drawn up, a supported squat, or on your back with knees bent and hips slightly elevated on a pillow. The secret to comfort is breath-guided relaxation. Take a slow inhale through your nose for 4 counts, then exhale for 6 counts while gently bearing down, like initiating a bowel movement, just as the lubricated tip rests at the entrance. That exhale and release moment is your green light because the pelvic floor opens and the tip can glide in without force. Advance only a couple of centimeters, pause, breathe, and let your body adapt. Your target is on the front, belly side, rectal wall. Angle the tip toward your navel. The prostate typically feels like a small, soft walnut. Once you contact it, use tiny, gentle circles or a press and release motion across the surface for 3 to 5 minutes. The pressure should be light to moderate, never digging or scraping. If your device vibrates, allow low vibration to do the work while you breathe. If it does not vibrate, add 3 to 5 rounds of gentle pelvic floor pulses. 1 second of a light stop urine squeeze followed by a full 2-second release to create a subtle mobilizing motion against the gland. Always emphasize the release. A tight but weak pelvic floor is common, and learning to let go is as important as learning to engage. A few orientation cues keep you safe and effective. You are contacting the prostate from behind. Your angle is forward toward the belly, not straight up. If your bladder is a little fuller, contact can create a fleeting urge to urinate. That is a sign you are on the right structure, but do not perform massage with a painfully full bladder. Work gently for 5 to 10 minutes, then stop. More is not better. 1 to 3 sessions per week is plenty for most men. Afterwards, hydrate, empty your bladder, and notice how the pelvis feels over the next day. There is also a top-down external option. Some men find helpful, especially leaner men. Lying on your back with knees bent, use the heel of your hand just above the pubic bone to apply slow, firm pressure down and slightly backward toward the bladder-prostate area for 30 to 60 seconds at a time, repeating a few cycles. This can complement perineal work and should never cause sharp pain or urinary difficulty. Let me address the most common concerns I hear. Will this hurt? Done correctly, no. Mild unfamiliar pressure is normal at first. Sharp pain is not. Will this change me or my orientation? No. Prostate care is a health practice, not a test of identity. Will it make symptoms worse? If you have active prostatitis, acute pelvic pain, fever, or a known cancer, do not do this until cleared by your doctor. For chronic pelvic discomfort with tight, overprotective muscles, gentle massage paired with breath and pelvic floor relaxation often helps. How often should I do this? Start once weekly, build to 2 or 3 times if you respond well, and then maintain the cadence that keeps you comfortable. Hygiene and device care matter. Use a barrier like a condom over a device if you share it with a partner. Clean with warm water and a gentle unscented cleanser designed for intimate devices, and allow it to fully dry. Never share unprotected devices. Do not mix water-based lube with silicone devices that specify water-based only. If you have hemorrhoids or fissures, postpone internal work until fully healed. Why does this help some men? Gentle mobilization can encourage drainage of prostatic secretions and ejaculatory ducts, reduce local congestion, rebalance pelvic floor tone, and improve awareness and circulation in a region that spends far too much time compressed by sitting. For men who sit long hours, drivers, desk workers, pair massage with blood flow breaks. Every 45 to 60 minutes, stand, do 3 slow squats, perform 3 rounds of the breath-guided pelvic floor release pattern, and walk for 1 minute. Sitting all day presses on nerves and vessels that your erections and urinary function rely on. Small movement snacks protect them. Here is a simple starter plan to make this practical. First week, learn the external perineal massage for 5 to 10 minutes, 2 or 3 times, paired with daily breath-guided pelvic floor releases. Second week, add one short internal session, 5 minutes maximum, on a day you feel well, and keep the external sessions. Third and fourth weeks, continue external work 2 or 3 times weekly, and internal work once or twice weekly if you feel benefit. Keep all sessions gentle, pain-free, and paired with breath and hydration. If symptoms worsen, stop and talk to your clinician. Here are your stop signs and call your doctor signs so you feel confident. Stop immediately if you notice sharp pain, bleeding, fever, chills, significant worsening urinary symptoms, or new swelling. Do not perform massage with an active infection, fever, severe pain, or after recent procedures, unless cleared. If you have a known or suspected prostate cancer, internal massage requires explicit clearance. Mechanical manipulation could be inappropriate in some cases. If you are on blood thinners or have a bleeding disorder, ask first. I want you to remember one simple line the next time you practice. Empty, lube, breathe, angle forward, and keep it comfortable. External or internal, your goal is calm mobilization, not force. When you treat this area with respect, it often rewards you with better comfort, more complete ejaculation, steadier urinary flow, and a quieter, more cooperative pelvic floor. If you try this, let me know what changed by the end of week 2. Less pressure, fewer aches, easier flow, or better recovery after intimacy. Your feedback helps other men approach this with clarity and confidence.